Often hailed as the father of Finnish modernism and even the humanist of modernism, Alvar Aalto belonged to a more alternative approach to modernist thinking. He believed architecture was not simply about creating walls and roofs, but about shaping the human experience inside them. Aalto was born in 1898. His career spanned over 50 years from the 1920s up until his death in 1976. He worked in close collaboration with his wife, Aino, up until her death in 1949. Aalto worked across architecture, furniture design, glassware, lighting, and even urban planning. His work is inextricably tied to Finnish culture and landscape. Born in Jyväskylä, he grew up among the forests and lakes of central Finland. Aalto absorbed lessons from nature that would define his career, such as light, air, texture, and rhythm. He studied at the Finnish Polytechnical Institute in Helsinki. A year into his study in 1918, he went to fight in the Finnish Civil War, which would eventuate in Finnish independence. There was a large movement through every sect to identify Finnish identity with its newfound independence. Through Aalto's career, his work demonstrates a consistent effort to determine this identity, shown through his continued use of incorporating vernacular architecture and Finnish biomorphic forms into modernist styles and theory. These ideas became the foundations for one of his most important works, the Paimio Sanatorium. Aalto's proposal for the building was submitted into a 1929 competition and demonstrates his early applications of functionalism and modernism. It is remotely situated in a pine forest in southwest Finland. Paimio demonstrates Aalto's approach to functionalism and his firm belief that buildings and new technologies should facilitate a deeper connection between people and nature. At this time, tuberculosis was one of the deadliest diseases in Europe. Fresh air, sunlight, and rest were considered essential to recovery. Aalto embraced these ideas and set out to create a building that was itself a medical instrument. Much of the organization is deemed to be influenced by the Zonnestraal Sanatorium built between 1926 to 1928 by Jan Doikes and Jan Gerko Wibenga. Although there are clear similarities, the comparison demonstrates some key organizational decisions. Zonnestraal is a pavilion-type hospital where the buildings are separated and rise to 2 stories which spread horizontally across the landscape. Paimio uses a block system where there is a singular building under which all patient administrative functions are. Paimio uses volume vertically, rising 6 stories tall. Aalto explains the programming and organization. The sanatorium shape derives from an attempt to handle separately each dissimilar part in this kind of establishment so that similar rooms and spaces are grouped together to form a wing. The wings are then linked to each other by a central part of the building, where common functions like stairs, lifts, etc. are grouped. Each different wing has been given a special position in the landscape according to the demands of the rooms. And as author Richard Weston put it, a functionally zoned plan, biodynamically aligned to the compass. The building's footprint, with its staggered wings, maximized both exposure to light and privacy of each patient's view. The patient wings are carefully oriented toward the southeast, allowing each room to capture the morning sun. Large windows stretched across the facades provide daylight and frame views of the surrounding forest. The use of windows was to allow patients, many confined to their beds for months, to be connected to nature. Ventilation was another crucial consideration. At a time before antibiotics, clean air was thought to be as vital as medicine. Aalto integrated advanced cross-ventilation systems throughout the sanatorium, ensuring constant circulation of fresh air. Radiators were considered as well, designed with horizontal fins so that they would not stir up dust and irritate the patient's lungs. The wide rooftop terraces and balconies, where patients could rest outdoors in reclining chairs, were designed as open-air treatment rooms. Colors throughout the sanatorium serve particular functions. Artist Aino Curia came to assist with the choices. Grays next to the handrail to hide discoloration from continued use, red on hot pipes to signal hazards. And ceilings were painted a softer toned green, and lighting was designed to be indirect. This was to reduce glare for bedridden patients, forced to look upward for hours each day. Yellow was used in the stairwells to show dust accumulation, but also to uplift spirits. He later came to regret how forceful the yellow was in the stairwells, but it's become a major feature of the building today. The furniture was equally purposeful. During this period, Alvar, Aino, and furniture manufacturer Otto Corhonen pioneered laminated benchwood birch. This was used to create the now iconic Paimio chair, which was shaped to angle the patient's body to ease the strain on their chest and make breathing easier. Rounded edges on furniture and fixtures were designed to reduce injury, while surfaces were smooth and easy to clean in a medical environment. Water basins in the rooms were tilted forward so that water could flow quietly, minimizing noise that would disturb rest during the long nights, which unfortunately didn't work in practice. Every element, from door handles to corridor widths, considered use and function. The wide publication of the sanatorium post its completion established Aalto's international reputation. New ideas about hospital design and epidemiology were incorporated into Paimio, but the overarching takeaways are the consideration of the patient's needs and the administrative processes of healthcare buildings. The aesthetics of the Aalto building would fit into the rising popularity and acceptance of the international style. Aalto would later depart from these streams of thought, even functionalism, and began to associate with part of a formalist front that stands it in opposition to a rational view of life and art. But through the analysis of this building, we can see the roots of divergence in his thinking behind Paimio. Ultimately, Aalto's work challenges us to consider the purpose of architecture. The Paimio Sanatorium demonstrates that a building can do more than provide shelter, but consider functions as care, comfort, and healing. The use of biodynamically positioned forms based on function demonstrate his belief that buildings should facilitate people's connection to nature. His legacy shows that thoughtful, human-centered design is not just possible, but essential.